of that. And then not just ticks, but other vectors, mosquitoes and lice, have also been found to be able to transmit the Borrelia and the co-infections. Okay. So, in addition, well, I mentioned the plasmids that that Borrelia has, and how it's able to confer advantages. And so, one of these advantages is its ability to shift between 3 different forms, and this is what makes it difficult to treat. It has a cell wall form, a cystic form, and intracellular form. And in addition, it likes to hide in what's called biofilm, which is like, I like the way Dr. Cowden, he called it like snot. It provides a physical barrier for antibodies, and the patient's own immune system from reaching it. And it's considered a persister bacteria. There are other bacteria in this category, and there is a small fraction of these quiescent bacterial cells can survive lethal doses of antibiotics, and then they can regrow, leading to post-treatment relapse. So they can just kind of lie dormant and hide out and then kind of come back. So I think that's supposed to be 1995. Sorry for the typo there. 1995, Johns Hopkins University found that this CDC 2-tier testing missed up to 55% of positive Lyme's cases. There's also problems due to the labs and the variability and sensitivities ranging anywhere from 20 to 75%, 97%. And this is in part due to the number of species of Borrelia. Sorry. We're doing so good here. Okay, there we go. Okay, so due to the poor sensitivity of this current testing, 40% of Lyme's patients end up with long-term health problems. And the average patient sees 5 doctors over nearly 2 years before being diagnosed. And so it's really unfortunate, and you know, this disease is or this problem is near and dear to my heart, because the people that I see who are affected by this are near and dear to my heart. You know, they really have seen, the ones that I see have seen even more than that, have seen probably 10 doctors, and have suffered for, some of them have suffered for half their lives with this. So it really is devastating. So, okay, I'll take questions at the end. So, okay, so 500,000 people struggling with long-term late-stage Lyme. This is according to the CDC. About 10 to 20% of cases unresolved after 24 months. Okay, so why the confusion? Well, there's 2 standards of care regarding testing and the treatment of Lyme disease in this country right now. There's the IDSA, and then there's the ILADS guidelines. And they vary in both their diagnostic and treatment recommendations. So the IDSA states that Lyme tests are held to be reliable, and patients with persistent Lyme symptoms after standard of care treatment have what's called post-treatment Lyme disease with autoimmune phenomenon. So they don't believe in like chronic Lyme. ILADS, on the other hand, deems Lyme tests unreliable, and multiple factors on the MSIDS map, remember again, that brought up by Dr. Horowitz, account for the persistent symptoms, including persistent infections. So there's these 2 standards of care. And if you go to different doctors, you'll see that. You'll see the IDSA doctors, and that's generally how almost all medical practitioners have been trained under these guidelines. So usually the ILADS doctors are ones that have gone for additional training, and so they have, that's why there's different information. So I like this cartoon because it's unfortunate, but this is what's going on today. All right. So the test that the test I generally do on most people is a Western blot, but it's by IGeneX Laboratory. So the Western blot is looking at both IgM and IgG antibodies to Borrelia, and it's generally more specific and sensitive than ELISA testing. Conventional teaching reports that IgM is positive from week 1 of initial infection up to 6 to 8 weeks after, while IgG is typically positive a few months after initial infection. But the truth is IgG and IgM antibodies can oscillate back and forth in chronic Lyme, so the IgM can be positive at any time during the course of an illness. So we'll always check for both IgM and IgG, regardless of how long the patient has been sick. So again, I mentioned the IGeneX lab. They have improved sensitivity because they've expanded the number of strains of Borrelia on the Western blot, so increasing the visible number of bands. Okay, there's also Lyme PCR. This detects actual DNA, the plasmid DNA and genes of the Lyme bacteria. It can be performed on whole blood, serum, urine, breast milk, skin, and CSF, or cerebrospinal fluid. It has increased sensitivity to identify unusual strains of Borrelia burgdorferi, but in my experience, this is true, that the test is often negative due to the bacteria's ability to hide behind the biofilms. Standard PCR is generally not sensitive enough due to low numbers of bacteria present. So recently I read about the Lyme PCR test, but doing it after provoking a patient. So a provoked Lyme urine PCR may be more reliable, and it involves collecting the urine after rolfing. If you guys are familiar with that, it's kind of like, the best way to describe it would be like a really rigorous deep massage, and it can kind of allow the Borrelia to come out and then be identified in the urine. So this is something that I'm looking into trying on some patients. And in addition, provoking, we also have found that hyperbaric could also cause the Lyme species to come out into the blood. So doing a test after a hyperbaric treatment. There are a lot of ILADS doctors that will give antibiotic treatment and then do testing as well. Because a lot of times what happens is, and I'll go into that in a little bit, when you give antibiotics, they kind of go into hiding, and then after they kind of come out of hiding, and then you can catch them, and you can have a higher chance of having a positive test. So there's different ways to go about it to increase the likelihood of finding this. Some other helpful tests that I do here, I use the Asyra quite a bit. It's a bioenergetic testing device, and it can look for, the nice thing about the Asyra is that it has all of the different types and species in there. So it really allows me to look for ones that would never be found on blood testing or some of these other traditional tests. So it's it's kind of part of the diagnostic picture. I don't use it for sole diagnostic purposes, but it is very helpful. CD57 I usually run. It's controversial, but it often does correlate with how a patient feels and can be used to guide clinical treatment. Dark field microscopy, we don't have it here, but if it is a great way to be able to look and just see the Borrelia, as I showed you in the beginning. Under dark field microscopy, you can see it, that cork-shaped bacteria. And then advanced labs, they do a culture test, which is 94% sensitive. They can culture up to 16 weeks to see if it grows. Let's see here. There's more tests. There's actually quite a few tests, and I didn't list them all because there's not enough time to go over all of them, but there are more tests out there and more that are being developed. So let's go to treatment. The treatment of Lyme is complex, as we can imagine after talking about all the different presentations. It's due to the factors we discussed, the persistence of this bacteria, the co-infections that it comes with, and then the inflammation and immune dysfunction that results as a result of all of this. So in order to treat Lyme's, you have to go ahead and treat all of these factors. So you have to address the infection itself, the inflammation, the toxicity, allergies, and we'll be going over all of these, but just to go real quickly, nutritional and enzyme deficiencies, mitochondrial dysfunction, psychological dysfunction, neurological dysfunction, endocrine disorders, sleep disorders, autonomic system dysfunctions, gastrointestinal disorders, elevated liver function tests, pain syndromes, and deconditioning that results. So we kind of have to look at everything in order to be able to, for people to get better. Okay, so why are antibiotics not effective? I mentioned before, in the presence of antibiotics, Borrelia go into cystic or intracellular form, and where the antibiotics can't get to it. And they are able to hide in the biofilms, again, and the antibiotics can't get in there. And while they're in there, they're able to mutate. They can share DNA and with their other bacteria, which is why there's probably all the different species that they're continuing to find. Okay, so what do I use instead? And there are doctors that do use the antibiotics. I don't use. I have patients who are on them, but I don't. That's not my go-to, and that's generally I try to stay away from them because of the issues associated with giving antibiotics long term. So there are herbal antimicrobials that we use. There is Dr. Cowden. He has a protocol with herbal antimicrobials, and Byron White also has a protocol with herbal antimicrobials that's very, very strong. And then there's homeopathics that can be used. Desiree Biologicals and Sanum, they make homeopathics for Lyme. The UVLRX, which is ultraviolet blood irradiation, it is ultraviolet light kills bacteria, viruses, and fungus. So it's a great treatment for Lyme, as you can imagine, because it can really kind of go after, it's not just targeted, it can go after all the bugs at one time. So this has been an effective treatment for patients. Ozone therapy. Dr. Shannon gave a lecture on ozone therapy recently, so I won't go into too much detail, but the ozone, is able to also destroy the bacteria and other pathogens, as well as really tone down inflammation in the body everywhere. So it's also a great treatment that a lot of patients have responded to. There is a Rife machine. Now this is something usually patients do at home, and I'm not going to go into too much about it, but it's there's books written about people being healed with Lyme with Rife therapy, and so it's frequency based treatment. Essential oils. Essential oils are antimicrobial and anti-inflammatory. Some of the most potent anti-inflammatories, in fact, and antimicrobials that exist. So I really like essential oils, and they can be given in different ways, rectally, as well as topically and aromatherapy. So essential oils, I kind of also have used that on patients. IV silver is something that can be very effective as well. I found that a lot of the patients that I have probably can't tolerate the IV silver, so I haven't used too much of it, but it really is also can be very effective. Elemental silver, it is effective and at killing pathogens. And then IV vitamin C, which we do here, and that also can directly kill pathogens, as well as really boost the immune system. So we use that quite a bit as well. Okay, so for as far as nutrition, I usually recommend an anti-inflammatory diet to patients. I like paleo. We've been also recommending ketogenic diets. I treat a lot of cancer as well. So this ketogenic diet, we started initially with a lot of our cancer patients, and now it's become kind of I think more popular. And the paleo diet is like the caveman diet, higher in protein and vegetables, no carbohydrates, minimal carbohydrates, I should say. But the ketogenic is a higher fat type of diet, 70 to 80% with 10% protein, 10% carbs. So I think they're both good because they're both anti-inflammatory. Probably ketogenic for people who have more, say, neurological problems. And if you're a patient here, you know that we are always talking about the food and how it can be either your poison or it is going to be your medicine. So making sure that you are eating organic as much as possible, foods that are free of pesticides and hormones, so organic produce, grass-fed meat, organic chicken, and then avoiding allergic or sensitive foods. And so these days, with all the issues that we have with the pesticides and the genetically modified foods, a lot of people have food sensitivities, and so I do a lot of food allergy testing for patients, and make sure that they're avoiding those, because those are going to cause leaky gut, inflammation, and we have some later on. We have some products here I'll talk about at the end that can help with that. And then reducing simple sugars, red meat, reducing eggs, dairy, gluten, and then histamine if you're sensitive to that. Finally, adding ingredients that support the liver. And I just listed, there's quite a lot of them. I'm not going to go over every single one. You can take a look. Let's see here. Okay, and here's a nice little diagram of the paleo diet, foods that are in the paleo diet and foods that are not. Okay, so also using antioxidants. We use a lot of antioxidants to lower inflammation, because there is a lot of inflammation. So curcumin, green tea, resveratrol, very good antioxidants, and phytochemicals, which sulforaphane, which is found in the cruciferous vegetables, are also very good at lowering inflammation, and a lot of times they also epigenetically turn off a lot of genes. So we have a product over here called Oncoplex that's great as well for that. And then low-dose naltrexone. I've used low-dose naltrexone quite a bit with cancer patients. It blocks activation of glial cells in the brain, and thus lowering and help to lower inflammation. Replacing minerals. Oftentimes, Lyme patients have a lot of deficiencies, but especially in zinc, copper, and magnesium. So we can do those specific tests through the regular lab, but usually I have patients do vitamin mineral testing to check all of their vitamins and minerals with either NutriVal or SpectraCell laboratories. Getting proper sleep and exercise is very, very important. Insomnia increases IL-6. In addition, it's found that when you sleep, the brain cells kind of shrink. They become smaller, and they actually allows the brain to detox. And so if you're not sleeping, you're also not being able to detox. So it's very important to get good sleep. And usually that's the first thing I work on with patients is the sleep, because getting a good night's sleep makes the whole world much better. Okay, so we use drainage remedies to clear the lymphatics, and balancing the hormones is very important. As I mentioned, the Lyme can actually cause decreased production of hormones. Adrenal support. Probably everybody with Lyme disease needs adrenal support because of all of the stress on the body. The adrenal is usually lower functioning. And then finally, to heal and damage the mind and emotion. There's always, like I mentioned, it could directly cause create an environment conducive to, not, in this case we're talking about Lyme, but we always talk about how that can create the environment conducive to any disease. So it's very important to address this as well. Two things that we use here in the office, Evox and Biosound, two instruments that we use to help patients deal with issues related to the emotions. Meditation is also very, very helpful, and a lot of patients do yoga, and that's also very good. Let's see here. Okay, so detoxification, if you've been here for any long period of time, we always talk about detoxification, how important that is to help remove the chemicals as well as the inflammatory cytokines that are causing the inflammation. So you can detoxify through the skin, and far infrared sauna, I feel like, is one of the best ways to detoxify the whole body. We have a little portable one over here on the side. But we also have the big wooden one as well here. This is nice because this is nice for home use if you don't have a lot of room. Liver, coffee enemas, which I had mentioned earlier, are great for detoxifying the liver. It increases glutathione levels in the liver and allows the liver then to package up those toxins and remove them. Vitamins and minerals and herbs as well can be used to help the liver detoxify. For the colon, probiotics and as well as colon hydrotherapy are very effective. And also we need to not forget about the kidneys and make sure that we detoxify the kidneys, and there's different supplements and so forth that can be used for that. And also, and of course, always making sure that we're drinking plenty of water. Half your body weight in ounces is what is recommended for water intake. Heavy metals, I would probably say that almost all my Lyme patients have heavy metals. And so I do test for them, and if found, we need to make sure we eliminate those. And there's different ways to do that. Removing mercury, very important, especially from teeth. If we have amalgams in the mouth, we recommend that patients have those removed because those can outgas, especially when you chew, and that can increase mercury levels in the body. Mold toxins also. If you have a known mold exposure, or sometimes you don't, but a lot of patients will have a known mold exposure, and I'll go ahead and order through real-time laboratories. We can check for different molds to see their levels. Pesticides, as I mentioned earlier, can really wreak so much havoc in the body, and there is a laboratory, PacTux, that can check levels of pesticides. And finally, electromagnetic radiation. The thing about electromagnetic radiation is that it makes the bugs go crazy. Okay, they absolutely just start dividing more rapidly under influence of electromagnetic radiation. So electromagnetic radiation, for those of you who don't know, come from cell towers and power lines, your phones, your laptops, computers. So all of these things, we've got to work on reducing that, because that is going to inhibit the ability for a person to get better. And some people are extremely sensitive, and some people are not so sensitive. But it definitely is a problem today for everybody. So this is because I love the far infrared sauna. I just thought we'd show a picture. So this is our infrared sauna, and it's very good for relaxing and cleansing the body. It can improve overall health and promotes a sense of well-being. It does help to release the accumulated toxins, pesticides, PCBs, drug residues, acidic wastes, non-essential trace metals, increases circulation, oxygen, and nutrient delivery within the body. It improves immune function, and it helps alleviate pain and improves joint mobility. So I really love the sauna. Okay, so we're almost finished here. I just want to make a note about Lyme and autoimmunity. What happens is that there's these blebs that are shed, and they contain partial DNA. And so what happens is that they are highly stimulatory to the immune system, and they can result in the host cell becoming targets for the immune system, and therefore a patient develops autoimmunity. So it's very important to check patients for ANA, and many Lyme patients are indeed positive for ANA. Some are positive for rheumatoid factor as well. As I said, some patients, that's what they come in, is with just a diagnosis of rheumatoid arthritis, and then I find that they have Lyme. So, and can you have both? Of course. And in general, the case is that it's always, multiple. It's multiple symptoms, but it's also multiple diagnoses that we'll find with Lyme. So I just want to mention that, because this is a big issue. Let's see here. And I think we're done. Does anybody have... I'll open it up for questions. No. Does anybody have questions? Yes?
Go ahead. No, there's two items. What is your e-box? I've not heard of that. Is that a machine? Or is it...
Yeah, it's let's see. I'm trying to remember the. I forgot the acronym for it. But basically, what it is that it's a device that's able to analyze your voice, and it can check for 8 underlying areas of emotion and see if what's off. So it's a very objective test, which is what I like about it, and it is usually right on point with patients. So it's usually 6 sessions, and I usually tell them to just come and do 1 session to try it out. And so it's a really, we use it actually a lot for our cancer patients. But anybody who has a chronic illness or chronic disease, it's really good to make sure that you clear that and make sure there's no toxic emotions, because what it does is that creates the environment that allows any type of disease to persist in the body. Mm-hmm.
These bacteria, can they live in an alkaline system?
Well, you can be alkaline, but these, like I said, they can hide. They hide in that biofilm, and they're essentially protected.
In the alkaline system?
Yes. Mm-hmm.
Do you have a rice machine here?
No?
I do have one, but it is one that I usually just have patients try, and usually so they can purchase their own. That's what I usually recommend.
And for the Lyme diagnosis, is there any kind of an average amount of treatments it needs, or is it according to how infected they are?
For the Rife?
To use, yeah.
How
using the
often?
Rife machine. How many treatments do they usually need?
Well,
Is there
generally, you have to do a lot, but generally speaking, how it works is that there's many different machines out there, and as far as how often you do it, generally speaking, the rule is, when you are killing bugs, you can get what's called a Herxheimer reaction. It's a die-off reaction, and you can get flu-like symptoms. And so if you do a treatment and you have those symptoms, then usually you wait until you're over them before you do another treatment. Yeah. So that's the general rule. So it'll vary from patient to patient as far as how often those are done. The thing about the Rife machine is that you have to get the right frequencies, and so that's the key to if the effectiveness of it. Any other questions?
As far as treatment, do you base it off of what kinds of bacteria there are, or I don't know how you decide what the best course of treatment is? Everyone seems to use that differently.
Yes. So, well, there are some treatments, like I said, that just will hit, like the UVLRX, for example, will just hit all different bugs. So, that's nice. Ozone, same thing. So that's the beauty of some of these treatments is that it kind of will go after everything. So, because when you're targeting a specific organism, and sometimes you do have to go after specific ones because it's kind of like peeling the layers of an onion. You kind of peel one layer off, and then you find new ones hiding underneath, and you peel that off, and it's kind of how it is treating Lyme disease. So you kind of go after what's what you're seeing, and then after you treat that, then you find more. So we kind of we do some targeted therapies for certain organisms. Yes.
Can I just ask a question that's relative to that? So in typical situations, it's unique and different. The length of time for the different protocols, would you say 6 months, a year? I mean, what would be an optimistic time frame?
I think that the longer you have it, the longer it takes to get better.
Okay.
Yeah.
So it's more systemic, it's more
It's-
deeply seated.
Yeah, it's more deeply seated, and I think it just takes a long time to get it out. So it varies. I think that because once you have chronic Lyme, I would say it's a minimum a year, minimum.
I'm thinking in some terms of financial, what the cost would be long term like that. And then of course just the commitment to do all the protocols.
It's a lot.
Yeah.
Yeah, it's a.
Can someone live with Lyme for their entire life? Obviously, their symptoms are going to cause less quality of life, but
It's exactly right. It's the quality of life, because the thing is that this doesn't kill you.
right.
It just makes you miserable. Right. Which is why this disease is so devastating for many people, and it drains them of all their resources and their funds and their ability to support themselves. Which is why it's really devastating.
So managing it really is the key.
Well, right. No, there are people.
Eradicate.
Right. Like truly eradicating Lyme. There are people, I think, who or have been eradicated of Lyme's. Love Lyme, but it's difficult, and I think you can have a low level of Lyme disease and then manage it, and those people can live productive lives, but it's very difficult to get rid of.
Just because I've been researching Germany a lot lately,
Uh-huh.
is there any developments with stem cell therapy for Lyme in this country?
Not that I'm aware of, but not stem. I'm not aware of the stem cell therapy. But since you brought up Germany, I did forget to mention hyperthermia treatments, which in Germany they do hypothermia for.
The box that you get in and you get real cold. Is that what
No, you get really hot.
Oh,
Yes, they heat you up to I think 104 degrees for 2 hours. Yes, and because Lyme can't live in that environment, and so
where the infrared sauna's helpful too.
the sauna is also good, but it's kind of hard to. You don't stay in there for
No.
2 hours, and they're watching your internal body temp. It's so that they're doing that, and they're also combining that. Some places are doing hypothermia alone or hypothermia combined, sometimes with, I think, different antimicrobials. So there's that also. Very expensive treatment as well, and it's not a cure-all, though. I have patients who've done it and then they come back and they still have to do supportive therapies for all the other stuff that we mentioned, right? Because you have to deal with all the other issues as well. So still have to do work.
Is any of this covered by insurance? Any of the therapies?
No, because of what we discussed, some of what we discussed. Generally speaking, the insurance companies will cover 30 days of antibiotics. Yep. So that's it. Uh-huh.
Check for Lyme. What about all these secondary infections like mycoplasma, rickettsia? Oh, did you check for all of those?
Oh,
at
yes.
the same time?
Oh yeah, we're looking. So the Asira, that's what the Asira that we talked about. It's able to pick up all the different things that a lot of times a patient has. I also do check for it in the blood. So I usually do titers for all the different bugs, and so we'll look for it that way too.
Do you use biociding to get through the biofilms?
I know of biocidin. I haven't really used the biocidin. I'm sure it is good. I think there are so many products, but it's referring to as a product that does help kill biofilm. But there's a lot of things that can actually kill the biofilm. So we do have.
How do you get kill the cysts and the intracellular forms of this? How do they get killed?
A lot of times what we do is for the cysts, we do use cyst busters. There are certain products and supplements and enzymes that can help to break open those cysts. A lot of the doctors, ILADS doctors that use the antibiotics, they do use the cyst busters. They've recognized that you can't just do antibiotics. You got to add the cyst busters in, and so that you're not causing them to all go into hiding. Because I think before, they realize that that's essentially what happened. You give antibiotics, they all go into hiding, and the patient feels great because they're all hiding out, and then as soon as they stop, it all comes back because they just all come out of hiding. And so, to the credit with the antibiotics is that it's a very sophisticated program. Dr. Horowitz does antibiotics, and it's very sophisticated. And he actually, I went to his talk over the weekend last week, and he was talking about using these old drugs that used to be used for leprosy. Yeah. It's the oh my gosh, what's it called? What was the name? I can't remember off the top of my head. It's an old drug.
Penicillin kind of a thing.
Yeah, I apologize. I can't remember the name of it, but it basically allows you to get to the intracellular forms. So using that in combination with other antibiotics, and so you could really get into the intracellular forms. So it's actually a very interesting idea. Again, my issue with antibiotics is most patients have gut issues, and a lot of the patients that do come to me have not tolerated antibiotics, and so usually I don't go that route. But it's interesting. I think what he discussed was interesting, and I'm thinking about it. Uh-huh.
I don't know how to ask this question, but can you have Lyme's disease and cancer too? Or would one eat the other one away or push it? I don't know.
Can you have it? Of course.
Really?
Oh, absolutely. Well, oh my gosh, why not? You can have Lyme disease, and you can have any other disease.
Okay.
it's like,
I'm thinking like one would eat the other one away or something. Maybe that's just my mind. I don't know. Just
yeah.
a crazy question.
No, and that, I like, the question brings up a good point, because a lot of times, you know, people think of that one pastor's one postulate theory, you know, you just one thing, you want to just attribute everything to one thing, and that's just not true. You know, you always have to think of all the other things, because most likely your patient has more than one thing.
Yeah, because your immune system has been compromised.
Exactly. So usually that's why this multi, you know, system and disease complex, you know, that we discussed is true. Lyme patients have everything. All of it, because the immune system and all the inflammation, and then all of a sudden everybody comes to the party.
Exactly.
Right.
They come to the dinner table.
Exactly. So, any other questions? Okay. So if not, let me just introduce Matt. He's from Zymogen. He's got some products here. He's going to be handing out some shakes. The GHI OptiCleanse is a really great formula for inflammation in the gut, and you can try some of that. He has a couple of other products here in the front that you guys can try. I don't know if you want to say a few words or not, but
yeah, pretty much everything. Lyme is obviously a very complicated disease, and these are just some of our formulas that they use here in the clinic to support your health.
all right.
Sometimes nice to try to taste something.
Okay, so so we can, for those who want to leave, you want to do the raffle real quick, and then we'll just
Yeah, you want to do it?
sure. And then we have you know, the shakes, and we have some snacks if people want to stay. Okay.
So let's do the saunas first.
Oh, you want me to do it? Okay.
Alright, let's see here. First one is 320076. Okay. Here you go. Oh, I got it. It's for 320069.
Could you repeat that?
320069. Nobody? 69?
Is her, maybe it's her?
Oh,
Is her ticket sitting there? No.
no.